Okay.
Hi, Victoria Aldrich here with Truffld. I'm speaking with Dr. Gail Saltz. She is the Clinical Associate Professor of Psychiatry at New York Presbyterian, Weill, Cornell School of Medicine. She is the host of the podcast Personology, which is hosted by iHeartRadio. And she's the author of several books. One we'll discuss most recently is Power of Different. And she's a media contributor, a regular media contributor, and is here with us today. Thank you very much. And I wanted to dig in a little bit. I read Power of Different, and it really struck me. I mean, I studied psychology in undergrad. I consider myself relatively well-versed in the area, but when I read that, it really was an eye-opener for me, because I think I've always seen mental health, even though it's fluid, as something that's a little bit more black and white. And not only did your book reinforce the gray area of it, but it also made me realize that I used to think that a lot of people, or a number of people, sat on some sort of mental health or brain different spectrum. But really what struck me is that somewhere on the brain different or mental health spectrum likely sits within every single one of us.
I really hoped to help people understand. The reason I think it's so important to understand that, to be honest, is that because people have believed that you either have a normal brain or an abnormal brain, and in addition define abnormal as something, we're stigmatizing. You don't want, it's all bad, you don't want it, you don't want to be around it. We have really shamed and marginalized, close to half of all people that, struggle with this, that the struggling is much more difficult when you feel alone and feel like you have to hide out. And that it is actually the number one reason that people don't get treatment. And most people don't get treatment. So I'm not advocating for that. I really think all people should get treatment to mitigate the suffering and the problems associated with having a mental health issue. But at the same time, I think being free to do that, to know that it's a very common occurrence, and to, more importantly, understand that there are probably particular strengths that are hardwired and associated with those very symptoms you're struggling with, and to be able to figure out what those are, the potential for great success, and utilize that is so important for the individual and so important for society.
Yeah, so let's get into those strengths and those assets in a second, the upside of these struggles. But first, let's start a little bit with COVID, because obviously, a lot of people are used to dealing with challenges in life. We expect them to some degree. But I think this forced isolation, and, we've always known that life is unpredictable. We logically know these things, but when it's thrown in your face virtually overnight, the unpredictability, the uncertainty, really having to completely rewire ourselves and adapt quickly in terms of how we engage with other human beings. All of those things, I think, have either, likely exacerbated existing mental health challenges that people have had, or perhaps people are experiencing them now for the first time as they're going through COVID. So what are you seeing in your practice between both of those groups?
Both of those things, that there are people who, as I said, close to half of all people at some point in their life will struggle with a mental health issue. So many people that I'm seeing, of course, have a past history of already having a struggle, particularly if you had an anxiety disorder of some sort or a mood disorder. The chronic stress associated with the situation, being in a fearful state much of the time. And, let's face it, there are realities to these anxieties. Yes, many people are having terrible economic struggles that are very frightening. They are increasingly aware perhaps of social injustices that they've been suffering, and, feeling very anxious about how that's going to play out, anxious about the political divide in this country, and moreover, or on top of all that, very anxious about the uncertainty associated with the trajectory of this COVID virus, and, whether whether there will be a vaccine and our whole change of life. Most people cope with those kinds of stresses by actually getting social support and being with other people. And of course, part of the solution here has been to social distance. So the increased feeling of lack of in-person social support, feeling isolated, feeling lonely. We know that lonely increases levels of anxiety and depression. All of that is more difficult, definitely if you had a history already, because once you do, due to something called the kinetic effect, you are likely or possibly may have another episode again in the future, and this is the kind of thing that would trigger that. But people who didn't feel that they were struggling with mental health issues before are, for the first time, having an unusual amount of uncertainty and chronic stress or loss. And loss can be defined, I don't necessarily mean, it could be you got sick and you lost some of your health. It could be someone close to you that you actually lost. But it could be, the loss of the fantasy of the future that you were going to have that you're now thinking you're not going to have, or important milestones, a graduation, a wedding, there are many forms of loss that are affecting people. So I am seeing a rise. And by the way, I am seeing, all of the surveys being done are seeing a tremendous rise in anxiety levels and anxiety disorders, mood disorders, substance abuse and use, rise in domestic violence, which, has a lot to do with these other issues as well. And I think that, many of us in my field are very concerned that we will, subsequently see a rise in suicide rates. But I think, obviously, this is a very difficult time, particularly from a mental health standpoint.
And how are we really coping right now? Because also those options have become a little bit more limited for a lot of people, dependent on their situation, whether it's access to healthcare, whether it's access to their socioeconomic situation has changed, or they can't get to their gym. There's all kinds of ways, and we know we can be resourceful. We know that exercise sort of can mimic the effects of, say, an SSRI, an antidepressant. But in general, I think people are still grappling with what are my options for coping? And I think for people who are really struggling, say they can't get out of bed, taking that first step to even try to exercise feels monumental. Or, so how right now would you best recommend that people take those steps in coping day to day?
I think most people don't think about the value and importance of preventive mental health care. We talk about all kinds of preventive, see your doctor to make sure that, your heart is doing well in advance, that you're not developing diabetes, that you're not developing, or that you're taking care of yourself in such a way as to prevent health issues that may come along. We don't do that with mental health care. We should be doing that. In my opinion, we should have always been doing that with mental health care. So I've been talking a lot about the coping tools that, building up a toolbox of things that you do preventively, or even to alleviate lower level, anxiety or mood issues at home. So that could be a regular practice of, for example, deep abdominal breathing, paced breathing, muscle relaxation, progressive muscle relaxation, definitely aerobic exercise. As you mentioned earlier, 30 minutes of aerobic exercise 3 to 4 times a week goes head to head with medication for mild to moderate depression. But really relieves stress, decreases anxiety, maintaining good sleep hygiene, because sleep is hugely important at this time when, these kinds of other issues may be attacking essentially your mental health, that maintaining, a good 7 to 9 hours of sleep, avoiding avoiding substance use in general, but certainly if you drink alcohol already, not increasing the amount of alcohol that you drink, which will only actually serve to disrupt sleep and usually lower mood and actually worsen mental health issues. So there are, and of course, actively having social support, even if that's over Zoom, even if that's over the phone, whatever it might be, that reaching out and having a support network, people that you can talk to ways that you can express your feeling state. For some people, that might be journaling, writing it down, talking with a friend or trusted family member. It's okay to have a good cry, particularly with someone who understands and you feel, that you can trust and you feel close with. Those actually are, it's relieving. It's relieving to know you're in good company, to be honest, and that you're not alone in those feeling states. But there is a point at which people may cross the threshold, even though they're doing those things for themselves, where they're either their anxiety level all day, or their a level of sadness or hopeless or helpless feelings all day are for several weeks are such that it's interrupting their ability to function. It's interrupting their ability to maintain social relationships or to perform their work because they can't concentrate, because they're really so plagued by these thoughts each day in some substantial way. It may be affecting their sleep and their appetite. Certainly, if they're having thoughts, life isn't worth living. There's sort of a whole host of symptoms that would say to you, okay, now it's time to seek an evaluation. The good news is, besides the fact that one can do all of these coping tools at home and help yourself on a day-to-day basis, is that we're all practicing telemedicine now. So accessibility for treatment is actually, in some ways, never been better. Because you don't have to go to someone's office. And in that same vein, there are so many different ways and platforms to seek treatment, some of which are quite low cost. They, like a Talkspace or something, that is an app essentially. But, all the way up through obviously the kinds of fees that, have been there all along. But I think coverage is right now better, more understanding that more people are having difficulty. And so, it's a matter of investigating what you're covered for, what you can afford to do, and reach out. In New York State, I mean, many of us are doing, especially during this COVID time, did literally sliding scale or free treatment for people who couldn't afford. So it depends where you are, but there are ways definitely to get an evaluation and treatment.
That's really great feedback. Let's end on a high note in terms of, well, that was a high note too, what you just provided, but another high note in terms of how we can turn these, I don't know if we should phrase them as afflictions or mental health suffering, brain differences. How can we flip those on their head and basically turn them into assets for ourselves?
So I'll break that into two parts. One is when it relates to what's going on now and COVID, I think if you want to look at it, this is an opportunity to build up that toolbox, of coping style and or seek treatment. And the good news about that is that what you're essentially doing is building resilience. Resilience is built by having difficult and sometimes awful things happen. It's not built by just life is great and I'm sailing through and, my parent has paved the way for me, so it's all good. It's making mistakes. It's having failures. It's falling down. It's having really crummy stuff happen, but and maybe feeling bad even along the way, but finding various ways to cope and manage those feeling states and get through. And by doing that, you are building the kind of resilience that later, when something else terrible happens, and to be honest, that's part of life. There's good parts and there's not good parts. Sooner or later, they're going to be difficult times. And the more resilience and coping skills you have built, the better that you will be able to weather that, and the stronger and sturdier you will feel overall as a human being. So I many people are doing that now. Many people really are doing that now, and it's working for them, and they've built something for a lifetime, let's just say. And when it comes to the day-to-day, you have some different wiring that is conferring a set of symptoms. The symptoms might be anxiety related, mood related, like depression or bipolar disorder. They might be attention related, like distractibility issues like attention deficit hyperactivity disorder. They might be having to do with your social skills ability, like on the autism spectrum, but pretty much on every mental health issue and or learning disability that you could think of. They're also, and my book really was about the research, specific research that shows the link between those wiring differences and differences that confer the potential for great strength. And potential is an important word because basically if you don't have any of these things, the likelihood, it's not that you can't be a genius or highly creative, but the likelihood is less than the person who actually has a mental health issue. However, if you have a mental health issue and you leave it untreated and you are severely ill, untreated, then your ability to mount that strength and use it and bring it to fruition is also low. So the important thing is to get treatment, but then to figure out what your potential is, what your strengths are, and use them, play to them. If you look back in history, you will be hard pressed to find an iconic figure that you would consider to be a leader in their field, music, arts, science, politics, who didn't turn out to have a mental health issue or learning difference. And I think
Madame Curie too, Marie Curie, sorry. And I didn't know that she was on that spectrum as well. So yeah.
Absolutely. Actually, season 2 of my podcast is coming out soon. And I actually cover Marie Curie, who, yes, struggled with terrible, really debilitating depressions in her life, but also managed her way through to win, to be, the only woman to win 2 Nobel Prizes in 2 different fields. Highly unusual, highly amazing. She was amazing. So that's not an unusual story when you think about the coalescence of mental illness and achievement and success. And so I hope that people will incorporate that into their thinking about mental illness and understand that the idea of stigma associated is really outmoded, is outdated. It's from a time when we didn't understand so much about mental illness, and to seek treatment.
Yeah, and on that note, that's a great place to end. And thank you so much. That's just every bit of information you just provided is really valuable. I think especially right now, people are craving this so much, and you gave a great kind of comprehensive guidance for us. So thank you.
Thanks so much for having me.
Thank you for being here. And to everyone else and the Truffld community, if this information is something that you're seeking each week, subscribe to truffld.com. Thank you, Dr. Saltz.
Thank you. And congratulations on your new venture.
Yeah, thank you. Thank you so much.
Great.